I really felt like the right thing for me to do was to focus. I was, of course, had focused really in my training then in surgery and immunology and oncology, that I really wanted to do surgical oncology and focus at first on all oncology. And then I thought over the course, as I was learning in business school and really learning about systems and really learning about how modern companies really use data and use learning, that there are ways to accelerate learning, and that medicine is a business like any other, and we should be thinking about innovation. But what really struck me was that there was just a complete lack of a systems approach for data collection with built-in process for driving improvement. And
well, what kind of data needs to be collected for breast cancer that's not being collected or not being databased properly?
Well, we take care of people. We collect the data on every person, but we don't routinely collect data on every single person and have their outcomes collected as part of care. I mean, people think that we do. We do that when we're doing big research papers, or we do it when we get data, we recollect it for registries, but it's not a routine part of care. And I think one of the big things that I've tried to work on in my career is to integrate a process where you are collecting the data for quality improvement, that your goal should be to do better tomorrow than you are today, that everything you should be doing should be about moving forward. And it's interesting, in business school, one of the systems that I really looked at was mammography screening. And I've got a number of my classmates to work with me on looking at these issues. And I looked at the international variation, and I looked at the way different people were approaching it. And I learned a lot about process and systems. And one of the reasons why I decided to focus on breast cancer was because at the time when I had finished my training, women were being treated terribly. And if someone had a mass, they would go to the operating room and they would not know if they were going to wake up with a radical mastectomy or not. This is sort of the late 80s.
They wouldn't tell them? Wow.
The late 80s. Okay. And women were not included in the decision-making process. There wasn't information. There weren't any centers where everything was put in one place for them. They were left to fend for themselves, and women were really angry. And I felt like, wow, this is an incredible opportunity. I can focus on breast cancer from soup to nuts, from methods of detection, screening, treatment, diagnosis. It's a way to insert science, to insert policy, and to really think about a comprehensive, systematic approach to improving not just the outcomes of care, but the care itself, to create more holistic systems, to make sure that you're taking care of the whole person, bringing all the people that were required to take care of someone into one center, to build a model center in my backyard, which I went to UCSF to do it this way, and to say, we can have high touch care, and we can have, systems of research that are really devoted to improvement. And,
so what does that look like today? And, at Quantum, what do you guys do that you wish would have been done years ago?
Well, I think so. I run the Breast Care Center at the University of California, San Francisco, and there are a number of things that we do today that we've been working on for years, and the wisdom study is one of those things. But the idea is, if you are at risk for, or you're worried that you have a symptom, or you have cancer, you come to one place, and all of the specialties are organized in one place for you, and your care is coordinated. That's what it looks like. But what we also want to do is we want to find ways to constantly improve what we do. So I'll talk about a couple of the initiatives. One of them is the I-SPY trial that, the big problem is obviously we don't want women to die of their disease. And but at the same time, we don't want to overtreat people who aren't going to benefit from particular treatments, or if they're not really at the same kind of risk, we don't want our treatments can be toxic. So we have over the years really learned that breast cancer, is not one disease. There's been a huge amount of science that's advanced, and we really understand that breast cancer is many diseases. Some grow very slowly and are fairly indolent, and we've identified that there are these indolent cancers, and you can really ratchet down and de-escalate treatment. You may not need radiation, or maybe you need, intraoperative or single focus targeted radiation. You don't necessarily, we can do smaller procedures. We do fewer axillary dissections, meaning we don't take out all the lymph nodes. We actually have been also trying to think about how do we move drug development